Good morning, everyone. Thank you for joining us here today. Dr. Cunningham and I are here to talk about the fight against the opioid addiction, also joined by John Morrison, representative of the Prosecuting Attorney's Office. We know that the holidays can be a time of joy, but they can also be a time of stress and isolation, and for those struggling with addiction, a high-risk time. So we're here today to talk about making Narcan more available in St. Louis County, and I'm excited to announce that we have another Narcan vending machine that we're going to make available on the ground floor of this building. This is a time when people are coming to this building in Clayton, our county headquarters, to pay their taxes. But they also have the opportunity now to carry Narcan just by pushing a button on the Narcan vending machine. And this is part of a broader strategy to normalize care for addiction, to make resources available to empower residents to carry Narcan. Carrying Narcan will save a life. It's the thing to do if you love your family and your neighbors and you want to take responsibility. I want to thank all of our partners in the community who are helping us get the word out to get Narcan into the community, who are carrying Narcan, and we're excited to have their help and their support. With us today is Dr. Cunningham, a Director of Public Health, who is here to tell us about a disturbing trend in our community that makes carrying Narcan even more important than it's ever been. Dr. Cunningham.
Thank you. Thank you, Dr. Page, and thank you for being here with us today. While we're here to recognize progress, we must all confront a dangerous and emerging threat, carfentanil. Overall, overdose deaths have dropped in St. Louis County over the last 3 years, and 2024 was the first time we saw an opioid overdose death drop across all reported demographics. However, we are seeing a troubling increase in overdose deaths involving carfentanil. So far in 2025, there have been 7 confirmed fatalities, compared to just 1 in all of 2024. Prior to that, only 2 deaths have ever been recorded in the county. Carfentanil is an extremely potent opioid. It's 100 times stronger than fentanyl and 10,000 times more stronger than morphine. It's used to tranquilize large animals like elephants, and even a small dose as a grain of salt can be deadly. Toxicology reports show that carfentanil is often mixed with fentanyl, making street drugs even more unpredictable and dangerous. Through our drug surveillance program at the health department, we've detected carfentanil in 18% of tested samples this year. This is significant and alarming. Carfentanil overdoses may require 3 to 4 doses of naloxone for reversal, compared to 1 to 2 doses for fentanyl. This is why access to naloxone is more critical than ever, because naloxone can reverse an opioid overdose if it's administered quickly, but only if people have it on hand. That's why we placed 27 naloxone vending machines in high traffic areas across St. Louis County, and we will continue to mail naloxone to residents, distributed through our county libraries, our health centers, and to individuals leaving the jail. These efforts are saving lives. And lastly, I want to announce a new overdose spike alert system. This system monitors for sudden increases in suspected drug overdose visits among St. Louis County residents. So our community partners, our hospitals, our law enforcement can sign up to receive an alert through the health department. The goal is to provide timely, actionable information to partners who may benefit from these alerts, whether it's response coordination, outreach, harm reduction, or general awareness. This is a public health crisis, and our response must be rooted in science, compassion, and community. It calls on communities, partners, and systems to act with urgency because lives depend on it, and this is what we do because we care. Thank you.
Thank you, Dr. Cunningham. Okay. We'd be glad to take any questions.
With the county council potentially voting to do $1 million in cuts, how would this impact day-to-day operations of the health department and our jobs on the line? How much?
So the question is about the proposed cuts in the county budget. We haven't seen those bills yet. I understand that some people have seen them, but my office hasn't seen them. But we will review them. We've heard the description of what those bills contain, but we really need to see the bills. Sometimes the bills don't do what people think they do. as described, the cuts are alarming, but we will have to wait till we read them and understand them to have a reaction to them. Less money obviously will mean less services available.
Can you just give your thoughts on the budget overall? What do you expect?
What you can expect on the budget?
Yeah.
Well, we can't react to the budget bills because we haven't read them or analyzed them or looked to see how they impact the county services. So we understand that there is a description of the budget floating around, the budget cuts, and there is a description of the budget bills, but we really need to read them before we can have an opinion or a perspective as to what their impacts might be. So it's going to take us a day or two to figure that out.
They're saying they're cutting hundreds of unfilled positions, saying they haven't been filled in over a year. We don't need them right now. Assuming that's true, you mentioned you need to see the bill. Does that worry you?
So the question is, what if a hypothetical was happening and the cuts affected positions? It's really hard for us to respond to hypothetical questions. So you're going to have to give us some time to actually read the budget bills, which we haven't seen yet, and then we'll have a position on what they mean and what their impacts are. These have been closely held, and for the past 3 months, we've been hearing descriptions of what might happen, and now we've heard a description of what might happen, and we need to look at the budget bills and see what's happening. I don't support cuts in public safety. I don't support less police officers. I support more, and I don't support less health care. I would like to see us provide more, but if we can continue our current healthcare safety net, I think that we would all be better off.
If the health director can answer, the council described what sounded like a collaborative process where they work with department heads to figure out what's being spent, what isn't, where the vacancies are still needed to be on the books, and where they are. How would you describe the process that your department went through?
Yeah, the question was that, the process that the county council had outlined with the new budget process, it was chaotic, and it was not as streamlined as I think we thought. I believe the intention was great. I think I would have enjoyed to love to walk them through the public health budget and where the pain points, and where as a director, I think that we can develop some solutions to increase revenue. Yesterday, I haven't seen the bill. I actually learned about the cuts listening to the media press conference yesterday. So I think that's unfortunate as a department head that I have not even been afforded the luxury to know what the cuts are so I can plan appropriately. And we're going to the end of the year. We got to have a decision made, and we got to have a plan in place. And I would have appreciated more transparency, and I would have appreciated a conversation and truly being heard throughout the process and listened to, because we run our departments. We know where the cuts are. We know how we can generate revenue. We're department heads. I lead the public health department because I care. I'm a strong leader, and I wish that would have been reflected in this process.
Council yesterday said that they, before they would get at the media thing yesterday, they went to the department heads and told them what was going on. Did they not talk to you?
No. Nope. I did not receive a phone call.
Dr. Cunningham, can you elaborate on the spike in overdoses that we're seeing? Is that just in St. Louis County? Is that regional or national? And how big of a spike is it?
Yeah, so for us with carfentanil, the reason why it's important is because it's a really potent opioid. So it's 100 times more potent than fentanyl. And really what you see that it requires at least 3 to 4 doses of naloxone to respond to it. Here in St. Louis County, we've never seen that many overdoses due to carfentanil. We had 7 so far this year. Last year we only saw 1. But across the nation, we're seeing increases in carfentanil, and it's unfortunately making its way into the illicit drug supply. This is a first for us, but other cities out in the southern states as well as on the East Coast, they've seen carfentanil in their street drugs. It's just now becoming more prevalent, and it's alarming and concerning.
You have the numbers of the opioid overdose overall this year?
Yeah, so in St. Louis County, we've had year-to-date 143 opioid deaths. We will continue to get provisional counts as well, but right now 143 in St. Louis County.
In 2022, I remember covering also a spike of overdose deaths, and there was an opioid action plan. Is that something you guys plan to roll out, or is this considered a part of that?
Yeah, it's considered a part of that plan. And so we've revamped and, of course, improved the strategy with that program, but that's still our overarching program. We just continue to expand resources to community. Thankfully, we receive grant funding to continue the great work that we're doing. And so we just continue to expand this important work.
You said this was in 27 places. Could you say maybe where are they? A specific location?
We have a map. I don't know all 27. We have a map that we can send to everyone. Our goal is to get 41 placed throughout St. Louis County, and this is definitely a hot spot. And so we can send a map to the media afterwards with all of our locations.
And then overdose deaths as a whole in Missouri are going down. Does this signify a reversal potentially, especially with fentanyl?
Yeah, so this with overdose deaths going down in the state of in Missouri, it doesn't signify a reversal. This is a time for us to be alarmed that we're seeing that our drug supply is changing. So anytime our drug supply change, you see a rise in overdoses. And so for us, knowing that we're monitoring this, we had 7 unfortunate deaths. This is the time to bring communities together, to get naloxone into the community, to educate people on how to use safely, educate people on what's in the drug supply. And so that's where public health come in, that I think that now we have a lot of resources and support to be able to be proactive. I will say, going back to the budget, I really hope that a lot of the services we provide are not cut, just because we do a lot in to address overdoses. And it's important to maintain access to healthcare and maintain access to behavioral healthcare as well.
This next question is for the county executive again. Today, the county council, they vote on the budget. You mentioned you have not received a copy of the budget. Do you find that alarming? Why haven't you received a copy?
Well, the question is why haven't we received a copy of the budget? I think the whole process has been delayed this year, and it's hard to say. The budget bills were made available last night or early this morning, and my office just hasn't been on the early notification list for a while. That's just a decision that the council's made and I think they're making their decisions a little bit late in the year too. About 3 or 4 years ago, the county changed its budget process to start the budget process on October 1st instead of November 1st to give us an extra 30 days to do the budget. And it really hasn't moved the budget timeline up much at all. So this is where we are. We will figure it out. If we're asked to do with less money, then we will describe to people in St. Louis County what services we will have to do with less of or without. You don't get more services with less money. It just doesn't work like that. And last year, there were significant budget cuts. And over the course of the year, another $120 million was added back in with supplemental appropriations as there were conversations about services that were needed. And the council decided to pass supplemental budgets to provide those services. We'll be having those conversations moving forward. What services do we want to do without or do with less of? And do we want to have some supplemental appropriations to try and restore some of these cuts? This is a tough conversation, but we'll have it, and we'll work through it. I would like to say something about carfentanil because it's been around for a while, but it hasn't been endemic in our community. And what we're seeing now is a drug that's 100 times more powerful than fentanyl, 1,000 times more powerful than morphine. Fentanyl was a game changer with overdose deaths and really caused the first spike. And now we have a drug that's 100 times more powerful than fentanyl, and we need to get ready for it. It's popping up in the community. It's mixed in with fentanyl, and everybody who can needs to be carrying Narcan. It's really the main reason why. That and the data collection, it's the main reason why overdose deaths are going down in our community. And we need to get more of it in people's hands who are walking around in the community and have a chance to interact with somebody who's had an overdose.
Dr. Page, is a veto of the budget still on the table for you?
Well, sure. I mean, we need to understand. We understand what's happening here, so it's going to take us a couple of days to figure this out. But that's always a possibility. We'll either veto the budget and give it back to them and give them a chance to make some adjustments, or and if that's the case, that'll be after the first of the year. or we will live with what we've got, provide less services, and have a conversation about what the community will tolerate.
Can you legally veto the budget? I think they've said that you don't have that authority.
We've had this conversation. Sure, we can veto the budget if that's necessary. That's perspective, I guess. There's a lot of rhetoric in politics, but yeah, if the budget needs to be vetoed, I'll veto it.
In terms of solving the problem in the future, you push on
That statement that my office needs to take the lead, I guess that's a political statement. I don't know. We've sent the request for legislation down to the council several times. We've talked about it. It's been on their agenda for months. They just need to decide to pass the ordinance to put it on the ballot, and then we'll all talk about it. I think the community understands that St. Louis County government is struggling with revenue to provide the services that people have come to expect, and we've been able to patch our budget together with one-time funds over the years, CARE funds, ARPA funds, the pandemic relief bundles, NFL funds, and at some point we're going to need a steady source of regular revenue to make sure that we are able to maintain our robust police department. That's the question in front of us. Are we going to cut police officer positions? We've started to recruit more police officers. We are starting to win that battle. It's tough everywhere across the country to recruit police officers, but providing less police officer jobs isn't the right path forward. So we'll talk about that for sure.
Council member said that I made a comment about too many free clinics in the health department. What are your thoughts on that?
The question is about too many free clinics in the health department. We're living in a time where in Washington they're cutting access to health care, cutting Medicaid, cutting Obamacare subsidies. At the state government, we're making it more difficult. They are making it more difficult to sign up for Medicaid. We're seeing a trend at state and national level to cut access to health care. Removing the health care safety net in St. Louis County at this time is a really, really bad idea, especially when we've just figured out a process to improve reimbursement dramatically and capture federal funds through this FQHC model to capture federal funds and bring more money into the health department budget that wasn't there in the past. The three clinics that provide care for people who are underinsured or uninsured are an important part of the safety net. They've been in the community for a long time, and this is the wrong time to cut those services.
I know the health department said that FQHC designation would potentially save millions of dollars. Have you seen those savings start to come in?
Well, I think there's the questions about FQHC savings. I think they're actually starting to impact this month, actually. But I'll let Dr. Cunningham talk about that.
Yeah, so two things with that. Before the designation, I will say in 2023, that was the first time the health department generated $2.4 million in revenue in the last 10 years. And so when I started, I immediately started to work on our billing and coding system so that we can save the clinics, number one, but then also make sure that we get the money from our insurance payers for the work that we're doing. We received the designation in June of this year. We're in the process of renegotiating contracts. I do believe maybe toward the end of this year, we may see a little bit of an increase with the revenue, but if not, definitely in 2026, we'll start to see some increase in revenue from this new designation.
The FQHC designation will get us at least $6, but more likely another $10 million a year in revenue to the health department. Losing that designation leaves that money on the table and doesn't capture it. The FQHC designation allows us to go back to the federal government and get paid for gaps in our healthcare budget. Gaps between our revenues and expenses can be covered by the federal government with this special FQHC designation. And that's why it's really not a good idea to turn those funds away, especially when our budgets are tight. No, we haven't had an FQHC designation for our clinics ever until this past year. And it was a 5-year application process to get it. We ran them as normal clinics that we provided the revenue. We built what we could, and we lost a lot of money on them. And we justified losing money because it was a service that was provided to the residents of St. Louis County. It was a safety net, and that's what the county residents decided to do when they passed the health care tax 40 years ago, when we used to have a county hospital, and now we just have 3 outpatient clinics. Getting the FQHC designation is bringing new revenue to the health clinics that wasn't there before for providing the same services. We're getting paid now by the federal government for services that we did not get paid by the federal government for in the past. So this FQHC designation is a really big deal, and there's not very many public health clinics in the country that are affiliated with the government to do this. It's an unusual thing, but it's worth doing. It took us 5 years, and when it's in full steam, we ought to get another $10 million a year from it.
One question about the vending machine. I know it's self-explanatory how to use it, but I think there's different naloxone and then there's wellness kits too.
Let's tell them what's in there.
Yeah, so thank you. I'm excited to talk about this. So yes, we have naloxone there, but we also have hygiene kits. So not paper towels, washcloths, toothbrushes, toothpaste. We also have combs are in there as well. We also have condoms in there as well. Additional supplies. I'm trying to see what else. Wound care kits. We do know what individuals who inject drugs, sometimes by the time they present to the hospital, it has, definitely become a really severe wound. So we also have supplies in there so individuals can take care of their wound before it becomes a major problem or become a chronic wound. And so, yes, we have naloxone, but we also have other wellness kits available for individuals as well. So the health department received a grant from the CDC's $2.6 million. And we're using that grant to help support this vending machine and a lot of the work that we're doing.
Just while we have
Can you show us how it works?
Yeah, Dr. You want to go? Oh, okay. Well, you just hit the button. Freeze. So I just hit one of the boxes with the naloxone. Here, somebody can use the QR code to go to our website to get additional information while they wait.
And it would deliver something.
All right. Pull it and there you go. Successful delivery. Take your goods.
And this will go down in the lobby.
Yes.
Dr. Cunningham, just while we have you here, the holidays are upon us. Anything going around, flu, COVID, that you see a spike in that maybe people should be aware of?
Yeah, so winter respiratory viruses. So yeah, we are seeing a slight increase. I still continue to recommend get your seasonal influenza vaccine as well as your COVID vaccine. If you're sick, stay at home. Continue to take care of yourself. Right now, a lot of the guidance is around all 3 of the respiratory viruses, so flu, COVID, as well as RSV. So right now, protect yourself, protect your families by getting vaccinated, and if you're sick, stay at home.
Okay, thank you. Thanks for getting the word out, and let's get everyone to carry some Narcan. You can take one of these with you.